Hello, I am Dr. Sanjeev. I am a senior pediatrician in Cloudnine Hospital, Electronic City, Bangalore. Fever is a common phenomena that we see after vaccination, particularly the DPT vaccination that we give. And now that a lot of adults also know the value of vaccination and the pain of vaccination and the fever that is associated in vaccination after the COVID vaccination that they have got. Vaccines with a fever is not a disease. It is just a reaction of the body to the vaccine and the antigens that are there in the vaccines. The fever in a vaccine should not be very troublesome, except that some vaccines, particularly the DPT vaccine, causes more fever than other vaccines, and this causes a lot of worry in parents. Fever after vaccination is a normal phenomena. The parents should not panic about that, and the only medicines we usually require is paracetamol. It's the body's way to react to the vaccine and generate immunity, or what is also called as pyrogenesis. Sometimes that happens with the vaccine components that are given. So this body reacts in the form of generating more temperature, which is not unusual. It is not an infection, it is not a disease, it should not be worried upon. Sometimes some children react differently. Majority of the children nowadays with the new generation vaccine do not generate too much of fever, but still some children can have. The only concern sometimes that stays with the parents is some children can throw a fit. If there is a family history of fits with fever, such parents have a little concern about that, but that does not mean that your child should not be vaccinated, because fever that comes generally with vaccines are usually mild to moderate, whereas if the same disease comes to the child, can be having a lot of havoc on the baby. So it's better to have a vaccine fever than the fever because of the disease itself. So at the end, what I would say is the fever that comes with vaccines is mild to moderate. It is benign, it doesn't cause usually any problems. A simple paracetamol is more than enough to take care of the fever. Usually it lasts for a day or two and not more than that. Anytime if a child has very high fever, shows any other symptoms like getting very sick, not responding, throwing a fit, then that is a totally different phenomena, and if such thing happens, then you should even immediately return to the hospital and the concerned people will take care of you.